How many people do you think are walking around with cancer that are undiagnosed?
Gosh, I have no idea. I'm sure many. It would only be a guess, a total stab in the dark as to give you a number. And do you want me to guess?
No, I just wanted your reaction.
Yeah, that's, gosh.
A lot.
Yeah, oh yeah. I'm sure there's many, many people walking around with undiagnosed cancer. I'd be willing to bet there are people with cancer with spontaneous regression too. So they may have cancer and then their body happens to take care of it. The theory also is that we're all sort of developing cancers at all the time. And our immune system surveils that and is able to see most of them and destroy them before they become a problem. It's the ones that get by our immune system that become the issue. So if that theory is correct, we are all developing cancers on a regular basis, but we're able to keep them under control. So if that's the case, then all of us. But how many of us have cancers that become a problem that are undiagnosed? I don't know, but I'm sure a lot.
I think there are a lot. I think that, and it may be for multiple different type reasons. I think some people are less educated, some people have less access. I think that some people, whether it's lost insurance, whether they don't have access to facilities or people close by that can take time to evaluate things. But I think that, I think there are way too many, let's put it that way. Too many.
I think a lot. I mean, keep in mind, some cancers, quote unquote cancers, may not be clinically relevant ever. So especially if you talk about older men and prostate cancer. So, we have a knee-jerk, anyone with cancer, you got to do something. I think a humbling experience for us has been, especially men, if we live long enough, we're all going to get prostate cancer. Many of us, it'll never be an issue. So it's become somewhat of a challenge to say, in whom should we really look for it? Because what happened when the PSA testing first came available, we did it on everybody, and we found 95-year-old men who had prostate cancer. Oh, go have surgery and radiation, treat your prostate cancer, and it never would have impacted them. So I think, if you look at that number is going to be big. There are certain types of leukemia that I see, which are, leukemia is always a scary word, but there are chronic forms of leukemia that may never affect people. And so I think, part of the reason why we're sort of seeing more cancer is that we're sort of looking for diseases that we couldn't really look for before, and they're not always, as a knee-jerk, something you need to do anything about.